This is my story of community health nursing. I want to tell you where it's taken me over the past 30 years. I did not want to work in a sterile hospital setting with its focus on machines instead of people. Instead, I wanted to be a bold, intrepid nurse like this one. So I became a public health nurse in charge of a hypertension control project in Richmond, Virginia. Then I became a family nurse practitioner and opened a healthcare for the homeless clinic. This was in the 1980s with a huge increase in homelessness, including from Vietnam vets. I bandaged wounds, I washed feet, I did street outreach in Baltimore. I moved to Seattle and did outreach to shelters and worked in community health clinics focusing on homeless youth. My nursing work has taken me places like to Thailand, work in orphanages, in Hill Tribe clinics in the Golden Triangle, with street outreach workers in Bangkok, and even under bridges. More recently, my work has taken me to New Zealand to understand the complexity of their post-earthquake recovery efforts, including public mental health campaigns, and reflecting on the lessons back here at home in the US, like what we should learn from the Hurricane Katrina disaster in New Orleans. It's taken me silly places like Hobbit homes. It's taken me to marches in Washington, D.C. It's made me more aware of politics and policies in my own neighborhood that impact health and homelessness. I write about these issues, sometimes quietly, sometimes more loudly, including on my Medical Margins blog. I speak out on issues related to healthcare and homelessness, and I do health policy work. I train health science students in compassionate care for homeless populations. I try to teach them the importance of humility, of not letting people stop you from doing what's right, looking past the myriad barriers that tried to divide us, seeing the face on the other side, not turning our backs on suffering. Instead, to walk the talk, to dream a better world.